Thanks.
Thank you for coming. Our specialist here.
You came here to see me? Thank you.
I have 3 quick questions.
Sure.
One of them is, what is your policy on X-rays? Because I've had a really hard time finding a dentist in the DC area that doesn't insist on
X-rays. Yeah.
Number 2 is, I heard that BPA, which we're all trying to avoid in plastics, is actually an ingredient in composite material that we use for fittings. How do you feel about that? And the 3rd question is, I suffer from TMJ, and I don't want to sleep with a plastic night guard in my mouth every night, because who knows what chemicals are in that. What would you recommend as a holistic treatment for TMJ?
You got some.
Thank you.
Just 3 little questions, right? Okay, so question about X-rays, TMJ, and BPA. Okay, so let me tackle X-rays first. X-rays for us are important because what happens is that I'm able to see things that I can't see without my naked eye, and it helps in the diagnosis of seeing what is it that's there. Not just it's a good service for the patient, because if something happens with that patient, let's say for example you don't have any X-rays and everything looks okay, but then underneath there that you might have like some God forbid you have like some issue happening there, then you've really done a disservice to the patient. So it's nice to have X-rays, and we don't take X-rays all the time. If sometimes, even if the patient has had an older X-ray, we can take a look at that just so that we kind of have like an idea that what is it that's going on there. Because medical legally also that there's an issue with that. If you're supposed to treat the patient, whether you're holistic or not, you treat them to the standard of care. And the standard of care a lot of times is that they demand that you have X-rays, so it's like you're in a tough position really, because if you don't do it, and you can get into a lot of trouble for that. But like I said, even if you take like just a couple of X-rays, you might not even have to take like a whole pan. Even if you take like, we see patients sometimes with 4 bite wings, 4 on each side. We can see, it kind of like gives you an idea of what it is that's going on. BPA, yes, those composite, when you remove the amalgam fillings, usually you replace those fillings with a composite. If it's a very large filling, what we do is we replace it with what's called an onlay. An onlay is something that, if you can imagine, the filling is sitting there, and then you take it out and now there's a hole. That hole, you take a mold of that hole and you send it to the lab, and then the lab will make you something that fits, computer generated, that fits exactly into that hole. It's not composite. It's a very hard like a ceramic type of material that you use for that. But if you're going to replace with a composite, there are composites that have BPA. But there are also composites that don't have BPA in them. They make composites that don't have BPA. The ones that we use at the office don't have BPA. It just takes a little bit of research to find out the ones that do and the ones that don't. But that's what happens with the composites. And the last one with the TMJ. The TMJ is like a, it's an issue that you have. You have like pain, chronic pain, Well, what we found is that we do use the splint for our patients. We see a lot of patients that have the TMJ issues, and we do use the splint for them. And what they've reported is that much less pain, much less headaches. Their muscles don't feel like it's that like hard. Like in the morning it gets like really tight. So the other thing that you might want to try with TMJ is that you might want to try some craniosacral. Have you tried that? You tried all? It works? Yeah. So you try some craniosacral. Also, you might want to check also with the TMJs to find out why that is. Sometimes it's because you have like interferences with one of your teeth. So for example, if one of your teeth at the back, let's say you had a filling or a crown, or even had your own natural teeth, and it doesn't come together properly with your bottom teeth, then what ends up happening is that your top teeth, your other teeth, let's say it's at the top, then when your teeth come together, there's going to be a tendency for you to kind of like try to grind it down because it's not, your teeth are not coming together. That also could cause some problems with the TMJ. And once you release that, that interference, then you find that the patient might get some relief. But I would say massage, the craniofacial, that, maybe even like some chiropractic type stuff, those I think would work pretty well with that. I'm gonna come to you.